This video is regarding the new curriculum which is implemented by NCISM for Ayurveda faculty for first BAMS professional and second BAMS professional. So let us see certain terminologies which are mentioned in this curriculum. So the first one is CBDC, that is competency based dynamic curriculum, the name given to this curriculum. The previously used curriculum which is followed now for the fourth BAMS, it is known as non-CBDC pattern. That means the curriculum which was developed previously, and it is also known as OBC, that is outcome based curriculum. Now let us start with certain terminologies. So the first one is curriculum. The curriculum is defined as the guideline of the academic content covered by an education system while undergoing a particular course or program. Next is graduate attributes. Now graduate attributes means certain specialities. The specialities a student shall have during graduation at university, and this should reflect the particular quality and feature or characteristic of an individual, that is student, including the knowledge, skills, attitudes and his values. Next is program specific outcomes. Program specific outcomes means what the graduate student of a specific degree program should know or should understand, should achieve at the end of the course or at the end of the program. Next comes the course outcomes. Now course outcomes are the resultant knowledge skills that the student should acquire at the end of the course. That is, now here the word course refers to the subject, a particular subject, that is at the end of the subject, each subject syllabus taught in each year. So for each subject there are specific course learning outcomes, and these all the outcomes should be achieved by conducting lectures, non-lectures and the assessment, proper assessment programs. So in these lectures and non-lectures there are various teaching learning methods mentioned, such as group discussion is there, lecture is there, that is known as didactic teaching, or there are problem based learning, there is project based learning, game based learning, and so many methods are mentioned. Then comes the learning outcome. Now learning outcome is the specific outcomes which we mentioned in the beginning of our lecture, which will be achieved at the end. Next comes the IA, that is internal assessment. Now the assessment is divided into two parts, that is formative assessment and summative assessment. The formative assessment, the assessment of students done in the intermittent course before final university examination. For example, term end examinations and the 9 periodical examinations which are mentioned in the curriculum. Next is the summative assessment. Now summative means the last assessment of each professional year, that is the university examinations are counted under summative assessment. Then there are certain assessment methods given for practical evaluation of students' knowledge. So this includes OSPE and OSCE. So let us see in short what exactly does this mean. So OSPE is Objective Structured Practical Examination. It is a method of examination to be adopted for practical examination, especially conducted for first and second professional as per CBDC. So in this OSPE, certain stations are mentioned and the student has to approach each station. Some stations are attended by the examiner and some could be unattended also. So in this OSPE, the student has to write certain things and he has to perform as well. Then next is OSCE. So OSCE is Objective Structured Clinical Examination, a method of examination to be adopted for practical examination, especially conducted for clinical subject. There is one more assessment method, that is DOAP, which means demonstration, observation, assistance and performance. So this method is adopted in our day-to-day life. We demonstrate certain things, then we students, they observe, they assist us also, and then they perform. So these are the various stages of understanding by the student. There are two terminologies which are mentioned and which are very important in the curriculum, that is Miller's pyramid and Bloom's taxonomy. So let us see what is Miller's pyramid. So a Miller's pyramid, it is known as a pyramid of learning and teaching. Right, so it has got 4 stages. So the stages are knows how, shows how and does. So these are the levels of understanding. When we teach any topic to the students, there is a need of a particular topic also. Okay? But, at what level, up to what level a student should understand a particular topic. So it goes on increasing. So from knowing till performing and applying it in the practice are the various levels. So this Miller's pyramid tells us the levels of understanding of a particular student. Next is Bloom's taxonomy. So Bloom's taxonomy mainly comprises three learning domains. So the first one is the cognitive domain, second one is the psychomotor domain, and the third one is the affective domain. So the cognitive domain mainly involves knowledge and the development of intellectual skills. This includes the recall or recognition of specific facts, procedural patterns, and conceptual things that serve in the development of intellectual abilities and skills of a student. The next domain is the psychomotor domain. The psychomotor domain includes physical movement, coordination, and use of the motor skill areas. That means in cognitive domain, a student understands certain things, and in psychomotor domain, if we ask a student to perform certain procedures, then it will be included under this psychomotor domain. The third domain is the affective domain. It includes the ways in which people deal with external and internal phenomena emotionally, such as values, enthusiasm, and motivations. So the student should also understand if he is dealing with some patient, then how to deal with that patient, how to act and how to behave in that particular situation. So all this comes under this affective domain. That means when any topic is taught, the understanding levels can be measured on the basis of Miller's pyramid. Okay, and the domains also tell us what exactly the student is gaining through that particular topic. So these were few terminologies which are used and which is must for us to understand this to implement the curriculum in our day-to-day teaching learning process. Thank you very much.